Welcome and thanks for joining us. My guest today is Tiffany Martin. She's the Director of Consumer Brand Partnerships at UnitedHealthcare. Ms. Martin, good to have you with us.
Thank you. Very excited to be here today.
And branded consumer partnerships, those words don't necessarily come to the top of mind for people when choosing during open season a healthcare plan. So give us a little bit of the background on what partnerships are all about.
Yeah, so at United Healthcare and across United Health Group, we touch virtually every aspect of the healthcare system, and that really creates a lot of opportunities for people, employers, and organizations to collaborate with us to achieve a shared vision of a more modern and efficient healthcare system. So last year, we kicked off the Peloton partnership, and it's been so popular and valuable that we're really expanding into year two and are super excited about that partnership and that offering for our members.
And you at United Healthcare, I should say, have partnered with a lot of leading brands to support members' health, wellness journey. Tell us more about these strategic relationships. Who are some of them? And we'll get into some of the details of the new ones.
Yeah. So so at United Healthcare, collaborations are really a priority for us, especially when it comes to supporting the health and well-being of our members, which is why we've really forged relationships with some of the world's biggest and most beloved brands. More importantly, we really love to design these programs and digital health solutions to be as intuitive, convenient, and accessible as possible. So some of these digital fitness apps, like Peloton and Apple, are really helping Americans blend the gym and at-home exercise routines. Using some of those fitness apps to access live and on-demand fitness classes. So we're really excited to be offering that again to our members in the federal space.
And so what does the member get from this if they sign up? What do they receive and how does it help them?
Yeah, so United Healthcare commercial members, including federal employees, get access to a year-long subscription to Peloton app membership at no additional cost as part of their health benefits. They're also able to get a 12-month subscription for Apple Fitness Plus at no additional cost. As you know, Apple Fitness Plus offers a variety of studio-style workouts for iPhone, iPad, and Apple TV, including integrating with your Apple Watch for real-time fitness metrics. So both of these offers are really designed to help United Healthcare members prioritize their well-being through access to engaging content that really meets their interest, fitness level, and location.
And people vary a great deal, of course, into their fitness levels and their enthusiasm for this kind of thing. Is there a way for them to use these partnerships, to use these subscriptions to Peloton and Apple Fitness Plus in a way that they can set personal goals, whatever they want for their VO2 max or how fast they want to run a mile or how much weight they can lift? These can be tailored right in your devices so that you can meet individual goals and not just watch a class go on.
Yes, absolutely. This is really meant to be personalized to your fitness level, to your needs, to kind of get anything that you want out of your digital fitness routine.
And just to be clear, this is available to everyone that signs up for United Healthcare option.
Correct. That is correct.
And the fundamental idea here, you mentioned digital platforms. I mean, this is digital delivery of healthcare types of solutions or health and wellness solutions. It seems to point to the idea that the technology is really transforming the way people access healthcare, correct?
Yep, absolutely. Absolutely. So United Healthcare really believes that everyone should have access to health and information and care anywhere and anytime, helping people really more easily access treatments and take charge of their health. So, you know that during the COVID-19 pandemic, it created or triggered an unprecedented spike in the number of virtual care visits that we're seeing. And we're starting to see that telehealth really has staying power. So far in 2022, we've seen a 17x increase in the use of virtual care amongst our members compared to those before the pandemic. So 90% of Americans surveyed said that they want to continue using virtual care for non-urgent health needs. And here at United, we hear that, and we're trying to expand more into virtual care for delivering care to people.
And is virtual care always video telehealth, or can it be just audio, like on the telephone? I mean, what formats can it take?
Yes, it can take all of those formats, video, phone, text, all the different communication channels you think of today.
And have you seen, by the way, just as an aside, the emergence, I guess it's still pretty new, but the idea of peripherals that can measure blood pressure, temperature, and so forth that go into your phone or whatever device you're using and transmit that data to your healthcare practitioner to maybe enhance the whole experience on both ends?
Yes, we're definitely, we have a vision of bringing all of that together. We're focused on creating a more coordinated, connected, and personalized health system. So to improve health outcomes, lower costs, and create more satisfied consumers and care professionals. So to that end, we actually invest more than $5 billion in data, technology, and innovation. And this really helps to support some of those improved health outcomes that we just talked about. So part of that is integrating some of the biometric data that we could get, or some of that personalized data that your Apple Watch is collecting, and integrating it into our platforms to make it more accessible for our providers to get that kind of data, and deliver better care and more for the member.
And does UnitedHealthcare have a portal type of platform that brings all this together for individual members?
Yes, we actually have a number of different comprehensive dashboards that really give our team a 360 view of the member based on a lot of real-time data that they're collecting from different types of devices like the Apple Watch.
And interactions, sure. And outside of virtual care itself, what are some of the other digital health resources that you're offering this coming season?
One of the great examples of some of the other digital resources are our advocacy and navigation resources. So in these models, we actually use predictive personalization to anticipate a caller's needs, and then connect the member with the right advocate to best support all of their needs. And so our members have access to this type of enhanced advocacy model, which better supports health and experience all around. And our members also have other digital resources to help make more informed healthcare decisions, including personalized onboarding videos, a step-by-step breakdown of coverage, and easy access to claims and online payments, and so much more.
Interesting. I just want to ask you one follow-up question on that predictive calling, so that the system knows who it is that's calling in. And so that every time you pick up the phone, the recipient of the services, the customer, doesn't have to start explaining everything from the beginning. The system, and therefore who's on the other end of that line or that call, already knows who you are and what your issues are likely to be.
That's exactly right. That's exactly right. And so we have, this comprehensive dashboard that's really able to predict and to identify your call number, and everything about your profile, your benefits pop up, so that we can help better navigate you in your benefits and in the health system.
Okay. Anything people should know otherwise before they make that choice this open season to go for UnitedHealthcare?
Just that Peloton and Apple are part of our benefits, and UnitedHealthcare is the way to go.
And by the way, where can people go to get more information about this?
People can go to uhcfeds.com. So open season kicks off today and runs through December 12th.
All right, get yourself a good floor mat and away you go. I want to thank today's guest. Tiffany Martin is the Director of Consumer Brand Partnerships at UnitedHealthcare. Great to have you with us.
Thank you so much.
And I'm Tom Temin. You're listening to Federal News Network. Let's go back to the studio now for more on the Open Season Exchange.